Good afternoon. It's Mark Larson talking about COVID-19 in Kittitas County. So, to start with, all of our patients are currently doing well. No one is hospitalized from our county for COVID-19. Most of our patients have returned to work, and we had no new cases today. So, we are day 7 of our phase 2 variants, and we're able to apply for a phase 3 variants on the 17th of June, so it's 2 weeks away. So I'll end up talking about that at the end, but things are going well, and I'm proud of the folks in Kittitas County. Let's go to questions.
I'm the secretary for the nonprofit organization Radio City Repair Cafe. We operate under the umbrella of Ellensburg Independent Order of Oddfellows. For the past 2 years, we have been holding monthly second Saturday free repair clinics at the Oddfellows Cemetery Shop. We're still not sure where our organization fits within the safety guidelines.
Yeah, so currently you would not be able to be open as an essential business, but when we move into phase 3, you would be able to be open, having less than 50 people in a place at one time. The key is if you have volunteers that are older, those people are still considered high risk, so folks older than 65. So those folks should really not be spending this time volunteering until we get a vaccine.
During phase 2, is it safe to resume a card-playing group by wearing masks?
In phase 2, it's safe to do that. Those people would count as your 5 people outside of your own bubble per week. So if you had 3 people that you played hearts with every week, so that there would be 4 of you, then you'd have 2 more people that you could be with during the week. So it just is a limitation of the number of people that you're around. So you should still wear masks if you're going to be within 6 feet of somebody else, but yeah, that would be safe.
My folks are my best friends. They're in their 90s and still living at home. I see them briefly when delivering groceries. When will we be able to hug and eat together again? Not until a vaccine is available. This is so hard, but I don't want to endanger them either.
Yeah, they're in the very high risk category. So the answer to that is probably when we have a vaccine, because they would be the ones that would be at risk of getting severe disease with COVID-19. So yes, it is difficult. Hugging is not going to be okay for a while until we have a vaccine, but you can certainly go by with a mask on, but I would be really careful because of their age.
If you test positive for COVID-19, when is it safe to return to work? Are you still able to spread the virus? Will you need something to show your employer, such as a doctor's notes? What are the local guidelines for returning to work after COVID-19, and what online resources would you recommend for more info for the employee and or employer on this matter?
Yeah, so to answer the last part of that, you should go to the Washington Department of Health. So we follow their guidelines for returning to work. So there's a couple ways to return to work. One is to do a 2 negative tests. That can take a really long time, and we are not using that method currently. We're using a time-based method, so it is basically 7 days plus 3 days of not having any symptoms. So it's essentially 10 days. You would get released to go back to work by public health, and some employers have wanted a note, and some employers have not wanted a note. Usually, we send a note to the employer saying, here's this person is positive for COVID-19 and they are supposed to be off work until released by public health. So it has been confusing somewhat. It's really been confusing when people are working outside the county, and we've had to call human resources for some of those folks, but we've been happy to do that.
Do pending cases mean people who have had close contact with the case and who are staying home, or are pending cases people who have symptoms and are awaiting test results?
Pending cases are people who are waiting for test results. So those tests that are pending here currently are today's tests, yesterday's tests, Sundays and Saturdays. I don't believe we have Saturday's test result back yet. So those are the pending tests, and those are people who have had symptoms and have gone in to be tested.
My daughter's preschool was closed for about a month in April, mainly due to lower enrollments. They opened back up in May, but still with noticeably lower enrollments. We kept our daughter home. Now that we are in phase 2, I'm noticing a lot of people sending their kids back. I'd like to do the same at some point, but concerned about how many other kids she'll be exposed to and the limit of 5 people outside one's bubble. Is it safe for people to send their kids back to preschool in phase 2?
Yeah, that's a multi-level question. So like at work, sending your child to daycare doesn't count as the 5 people outside their bubble. So, because then you'd send your child to daycare and that would be the only people that they could interact with. So it doesn't count there. Most of us have to go back to work, so most of us have to figure out how our kids are going to be taken care of. So the daycares have been working really hard at safety, their safety plans, how to make sure that people are not sick when they come to daycare and those type of things, but you're going to have more exposure for sure. The only good thing about that is that we've got a lot of very responsible daycare owners in this county that are doing a really good job. And the other issue is that for the most part, those kids, even when they get sick, have gotten mild disease. So it's been a blessing for them, and we are thankful for our daycare providers. So I think that's it on the questions. I just want to talk a little bit about where we are with our phase 3. So today I received from Secretary of State Wiesman the application for phase 3, for going from phase 2 to phase 3. And so we are working on that. We have hospital capacity, so that piece is done. There's a variety of metrics that have to be met. Not all of those metrics have to be met, but you can go to the governor's website and look at those. We are meeting the metrics for testing, for case and contact investigation, for isolation and quarantine. And so those things are all really good. What we're going to have some difficulty with possibly is the number of cases. So our metric for that is 25 cases per 100,000. So that is about 12 cases in 2 weeks for Kittitas County. Our number is currently 79, so that's a running average. So I think we will be there by the time we get to June 17th, but it really is dependent upon you. So, because you're the ones that are going to get sick. So if you are wearing a mask, if you are maintaining social distancing, if you're staying within your bubble, then we're going to be able to move forward. If you decide those things are not important to me, then the ability to move forward out of phase 2 into phase 3 really falls into your bucket and is your responsibility. So I am asking you to help us so we can help you. Please pay attention to what's okay in each phase. Watch out for your neighbor and be kind, and we'll get through this. Take care. We'll see you tomorrow.